This is a presentation about warfarin, a commonly prescribed oral anticoagulant. Warfarin has an interesting origin, so let's go back in time to where it all began. In the 1920s, cattle in the plains of northern USA and Canada were mysteriously dying of internal bleeding. Eventually, the hemorrhaging livestock was traced back to the moldy sweet clover the cattle were grazing on. However, the compound responsible continued to elude scientists. After years of research, the agent responsible was finally discovered. Funded by the Wisconsin Alumni Research Foundation, large-scale isolation of dicriminal began. In 1945, it was put on the market as a rodenticide and was named Warfarin. A U.S. Army soldier attempted to commit suicide using the popular rat poison, and though he failed to kill himself, he did prove warfarin was safe for human consumption. Doctors began prescribing it for medical purposes, and in 1955, U.S. President Dwight Eisenhower was administered warfarin after suffering a myocardial infarction. Warfarin is primarily indicated for the prophylaxis and treatment of venous thrombosis, and by extension, pulmonary embolism. Also the prevention of thromboembolic complications due to atrial fibrillation and prosthetic heart valves, and the reduction in the risk of morbidity and mortality as a result of myocardial infarction and stroke. Warfarin works by disrupting the synthesis of anticoagulant protein C and S and vitamin K dependent clotting factors, which includes 2, 7, 9, and 10. In the body, glutamic acid, oxygen, and carbon dioxide are converted into gamma-carboxyglutamic acid. This amino acid forms a component of clotting factors 2, 7, 9, and 10. Now this conversion process takes place only in the presence of reduced vitamin K, which is converted into oxidized vitamin K as a byproduct of this reaction. The enzyme vitamin K reductase first converts this oxidized vitamin K back into vitamin K, and then again into reduced vitamin K, ready to produce more gamma-carboxyglutamic acid. Warfarin acts by inhibiting vitamin K reductase, thereby diminishing the levels of reduced vitamin K and preventing the production of gamma-carboxyglutamic acid residues, inhibiting the production of clotting factors 2, 7, 9, and 10. All patients will be assessed to determine if the benefits of warfarin treatment outweigh the risks. Advantages of warfarin include it prevents the formation of thrombus and the associated complications, it has a long duration of activity, it can be administered orally once daily, it can be reversed by vitamin K. Disadvantages include the inherent risk of hemorrhage associated with warfarin, a delayed onset of anticoagulant effect, a loss of vitamin K in the blood needed for proper bone health, narrow therapeutic window, numerous drug and food interactions, dosage variations from person to person. Monitoring the International Normalized Ratio, INR, is essential. Diet is crucial in the efficacy of treatment with warfarin. As stated above, there are numerous food interactions. However, of most importance are vitamin K-rich foods like kale, spinach, Brussels sprouts, and black-eyed peas, just to name a few. The advice here isn't to avoid these foods completely. Vitamin K is essential for our health, but be very mindful of the amount, ensuring that you consistently consume the same amount of vitamin K week to week to maintain a stable INR. Cranberry juice has also been shown to interact with warfarin, increasing the risk of bleeding. The future of anticoagulation treatment has been targeted to act directly upon thrombin to avoid some of the adverse effects of warfarin. Examples of these new anticoagulant drugs include dabigatran, rivaroxaban, and apixaban. Dabigatran is an alternative to warfarin for treating non-valvular atrial fibrillation. Dabigatran does have some advantages over warfarin, including no need to monitor INR and no dietary restrictions. In clinical studies, dabigatran has been shown to be equal to or more effective than warfarin for stroke prevention in atrial fibrillation. A disadvantage of dabigatran, it is not suitable for use in patients with prosthetic heart valves.